All right. Hello, everyone. My name is Rachel Moszkowicz. I'm an intern with the Climate Mental Health Network, which is a collaborative of community advocates focused on mental well-being who are changing our nation's conversation and response around climate crisis and emotions. I'm also a graduate student at Cal Poly Humboldt in the Environment Community Program, and I am joined today by Rhonda Moore, who is an autistic medical anthropologist and a program officer for the genetic counseling resource at the U.S. National Institutes of Health All of Us Research Program. Her work combines anthropological methods, ethics, data science, and clinical medicine to better understand patient experiences and health disparities across culturally and medically diverse care settings, cancer, pain, palliative care, community engaged research, and the differential and ethical impacts of new and emerging technologies on health outcomes in diverse and vulnerable populations. She's the writer and editor of the following books: Lived Experience of Neurodivergence and Climate Change, which will be coming out in 2026, Climate Change and Mental Health Equity, which we will be discussing today, that came out in 2024, The Handbook of Pain and Palliative Care, Biobehavioral Approaches to Pain, and Cancer Culture and Communication. Prior to serving at the All of Us Research Program, she was a program officer in global mental health at the U.S. NIMH. Her program in global mental health focused on social determinants of health, ethics of new and emerging technologies, and climate change and mental health. And she was also the program lead for the Digital Global Mental Health Technology Program in low and middle income countries. She received her PhD in cultural anthropology from Stanford University, followed by postdoctoral fellowships in behavioral science, Stanford Medical School, epidemiology, just butcher that, but that's okay, University of Texas, MD Anderson Cancer Center, and hospice palliative care training at St. Austell, Cornwall. So I'm really excited to be with Dr. Moore today to have a conversation on the book Climate Change and Mental Health Equity. And so to start, I want to ask you, Rhonda, I'm curious about your story, how you came to this work, and your own connection to climate mental health.
Thank you so much, Rachel, for having me today. I really appreciate it. I've always been interested in the environment and climate as part of our very being and who we are and how we express ourselves in the world and how we engage the world, our animal friends and other people. It's not just outside the self, but it's within us. It is something that I feel like if we have to nurture, or we will experience loss or grief, both personally and collectively. I've written about this in my poetry as part of being a gardener over the course of my life and noting the changes in the seasons and changes in growth cycles due to changes in climate. While most of my work before this focused on pain and palliative care, I've come to understand over my life of over 50 years, plus years, that we are in a climate crisis and more work is needed to be done on climate change and mental health as I tried to make my own sense of my own anxiety over the changing climate. I even took a job at the United States National Institutes on Mental Health, hoping to do more work on climate change and mental health, but was told by my supervisors at the time that we were not going to be doing much work in this area, and it was not going to be important as the work that I was doing on social drivers of mental health, which was the main focus of my portfolio at the time. Of course, we all know they're interrelated, but this is what I was told. And that was simply not acceptable to me. So I decided to edit a book on the topic to do my part to, in some small way, address the gap in the literature on this important and emerging area of climate change and mental health.
Yeah, that's wonderful. And is an area that absolutely needs more attention. And so I'm really happy we're having this conversation and that there is more and emergent work around it. So really grateful for your contributions. So looking at the book, Climate Change and Mental Health Equity, could you kind of give an overview of the book? What can the reader expect? What audience is it for? And then maybe we can go into just painting a picture of the intersection of climate and mental health for those that are new to this topic, or who have, experienced this connection intuitively, but have not had the words around it.
Oh no, thank you so much. This book explores the ongoing impact of climate change through three lenses: people, place, and community. It reflects on how climate change impacts the mental health of diverse populations, how these impacts manifest in various places, and the ways communities are affected but also demonstrate resilience. In this context, mental health equity refers to the state in which everyone has a fair and just opportunity to reach their highest level of mental health and emotional wellness. The book will also focus on mental health disparities in this space, as it is important to recognize the injustices that people experience in the context of the climate crisis. The collaborators for this book represent and reflect diverse cultural and biomedical settings in the global north, the global south, and indigenous pop perspectives across global settings. This book is organized as a set of sections. The book's introductory section by Clayton and colleagues orients the reader to the subject matter by introducing this important topic, highlighting the three illustrative geographic areas for which their substantial research is available: Australia, Canada, and the Philippines. And these authors summarize some general recommendations for responding to the threats to mental health while also promoting mental health resilience. Research shows that the impacts of climate change on mental health are not experienced equally across all people and populations, and there are still major gaps in this literature. And in the second section of the book, I focused on emphasizing these differential impacts by including chapters on people more susceptible to the effects of climate change on mental health, including those with lower socioeconomic status, pregnant people, children, adolescents, older populations, women, sex and gender minorities, people living with disabilities, sleep populations, indigenous populations, people who are incarcerated with the understanding that prisons are a place too, and people who are unhoused, and people living with serious mental illness and substance use disorders. Just saying there will be some overlap in how we think about people, place, and community. The climate injustice experienced by the global South communities, indigenous people, intergenerational injustice faced by youth, older populations, people with disabilities, and others must also be acknowledged and will be discussed in the book. Collaborative place-based approaches to improving health, population health will address and addressing health disparities are gaining momentum. There is a strong rationale for addressing health disparities as a place-based issue. Improving community conditions on geographic basis which may make a difference in improving mental health outcomes. Fewer studies, unfortunately, have focused on climate change, place, and mental health. And the chapters in this section of the book, place, mental health, and focus on resource-based vulnerability, humanitarian settings, and indigenous populations care for country that may help spur additional research and discussion of the climate, place, mental health connection. And then community, the climate related crisis can affect not only the mental health of individuals, but also the unity and resilience of communities as a whole. Indeed, individual mental health cannot be solely protected at an individual level. We need social systems are crucial at both the community and policy levels. And community connections and sense of place can enhance individual and community resilience. So the fourth and final section of the book focuses on community, and as the impacts of human activity harmful to the Earth's climate and global health continues to be documented, poetry is yet another medium documenting climate change and mental health impacts and the importance of community. For instance, in Safe Shores of Yore Meets the Climate Change War, autistic poet and artist EY describes her lived experiences of climate change in her lifetime, celebrating the beauty of the change of seasons in the past while lamenting current and ongoing changes in the environment. And she ends with a powerful call for community and resilience in the wake of climate change. The other chapters in the section use case studies to highlight community-based participatory research orientation as one approach to help fully understand and address mental health aspects and inequities of climate change. And the last section of the book also includes examinations of the potential of design to address and investigate the complex socio-technical context of climate change in the Netherlands, understanding the effects of disasters where risk is concentrated and how it changes throughout the course of disaster response and recovery on community mental health and climate change, equity, and mental health in faith-based communities. There are several audiences for the book: public health and mental health professionals, disability studies, and certainly climate change activists. It could also be a main text for any of the modules or programs or courses listed under primary audience of nursing, disability studies, sociology, public and global health, health promotion, natural sciences, and geography. You asked me to paint a picture of the intersection of mental health for those new to the topic or those who are experiencing the connection intuitively but have not had words around it. The World Health Organization and a growing number of leading public health and medical professionals believe climate change may be the leading, if not existential, threat of the 21st century. Climate change is often characterized as a threat multiplier, given its potential to exacerbate many already existing global challenges and threats, such as infectious disease, intersectional violence, and conflict over food, poverty, safe housing, and water, and other increasingly scarce resources. As a threat multiplier, climate change also interacts with the social and structural determinants of health, exacerbating health inequities across global settings for individuals and communities. Historically, there has been less of a focus on research on mental health impacts of climate change. And climate change poses significant impacts to physical health and therefore can pose added difficulties for people, both in terms of their physical and mental health conditions. Extreme weather events, which are increasing in severity and frequency due to climate change, including heat waves, wildfires, droughts, and extreme precipitation, also affect people's mental health and well being. The impacts of climate change on mental health can be direct, indirect, short, and long term, as well as intersectional. In this regard, I'm kind of inspired by the work of Fiona Charlson, Helen Berry, Susan Clayton, Tori Sui, Britt Ray, and more recently, Andreas Hines and Leslie Brandt. Climate change has direct, indirect, and short and long term, as well as intersectional effects on mental health. The direct, they're all interconnected and can cause aggregate effects that are associated with increased mental health disorders, such as post-traumatic stress disorder, depression, and anxiety. Direct impacts of climate change, such as extreme weather events, increased disasters, are likely to have immediate impacts on the prevalence and severity of illness, including increased infectious disease, co-occurring in multimorbidity in affected communities, with significant implications for healthcare systems, security, and infrastructures. Individuals exposed to natural disasters such as hurricanes, floods, and droughts are also at increased risk for mental disorders, including PTSD, depressive disorders, and anxiety disorders. The severity and duration of mental disorders following natural disasters may be increased by psychosocial stressors such as personal and financial loss, becoming unhoused, and forced migration, by vulnerabilities such as pre-existing mental health disorders and low social support, and by insufficient mental health care. These important issues are highlighted in chapters in the book and throughout the book in different sections. Terms such as climate anxiety, eco-anxiety, or eco-grief are often used to describe the indirect effects of climate change on people's anxiety, as well as comprehension of the possible impact of climate change. And as climate change continues to change and extreme weather events associated with climate change become more frequent, severe, and long lasting, the perception of the impact of climate on our environment is becoming a lived experience for more and more people. Several new terms for climate change induced distress have been introduced to describe long-term emotional consequences of anticipated or actual environmental changes. These may be referred to as psychoteric or earth-related mental health syndromes. Chronically, the existential threat about an uncertain future is driving increased eco-anxiety, eco-paralysis, eco-guilt, eco-psychology, ecological grief, biospheric concern, as well as solastalgia, the place-based emotional distress caused by environmental change, mourning the loss of ecosystems, landscapes, and species in the ways of life is likely to become more frequent experience around the world. However, there is a lack of conceptual clarity and systematic research efforts are needed regarding the different forms that such ecological grief may take.
Mm-hmm. Mm-hmm. Yeah.
Would you like me to define eco-anxiety and all of these other, or is it assumed that the audience will know that?
Maybe if you could define eco-anxiety, that would be really helpful. And thank you so much for that thorough overview as well. And I know for my work, I look a lot at youth and mental health and how there has been this increased mental health crisis among youth experiencing eco-anxiety. So yeah, if we could touch on that term, I think that would be helpful.
Oh no, definitely. Development of I think we're thinking about a new phenomenology of effects of climate change requires delineated these between the varied terms. Eco-anxiety is a special type of stress and worry related to the ecological crisis that climate change presents. Eco-anxiety can be interpreted as the framework of existential and psychodynamic psychology, as well as the social sciences. And worry about climate change is very common among children and young people, which you mentioned. And the other terms that I'm going to go into, eco paralysis, is characterized by the inability to meaningfully respond to local, ecological, and broader climatic change challenges. Eco paralysis can stem from either the sudden emotional shock caused by the threat of climate change, or alternatively by the cognitive dilemma of having too many and sometimes conflicting options for actions with unclear benefits or outcomes among multiple choices. Another important phenomena is eco guilt, which occurs when people realize they have violated personal or social standards of behavior with respect to their individual choices. For example, by calculating their individual carbon footprint and realizing their contribution to the scale of the climate change crisis might not be as big as they would like. Still another phenomena is a final concept to differentiate is solastalgia. And I'm probably mispronouncing that. Solastalgia, sorry.
That's okay. I had
Solas
a hard time with that one as well.
Solastalgia is similar to eco grief. It describes the anguish or despair we feel when we realize the place that we live and love is chronically deteriorating. And inherent to solastalgia, the comfort the individual derives from their home environment is gradually disappearing due to climate change, and those individuals have lived experience of the challenge of this change process. Um, the overarching and seemingly insurmountable scale of climate change can incite despair and hopelessness as actions to address climate change seem intangible or insignificant in comparison to the scale and magnitude of the threat. The perceived insignificance of acts to address climate change in light of the scale of the climate change problem may drive despair and influence how we interact with our environment as well as our community.
Yeah, thank you for that overview. And I also want to say something I appreciated so much about this book was just the depth of the global perspective on climate and mental health, and how it has this needed intersectional focus and is really about collective well-being. And thank you for painting that thorough picture of how kind of mental health and climate change are threaded together in all these complex ways. And I think, it helps us to consider too, in what ways climate is a part of our everyday world, how it exists within us and around us. And so I just appreciate the book for opening up so many of these important pathways and conversations around climate and mental health. And one pathway that I would like to delve a little bit into is about neurodiversity. And you're open about being autistic and having attention deficit disorder. And I'm wondering how neurodiversity, disability, or different ability can help shape our understanding of climate and mental health, and how centering neurodiversity is a necessary aspect to climate justice and climate mental health.
Thank you so much. I am open about being a late diagnosed autistic and having attention deficit hyperactivity disorder and anxiety, as I firmly believe that the lived experiences of the neurodivergent community not only matter, but are also critical to shaping understandings of climate change and mental health, and the disproportionate impacts of certain bodies and minds, and how centering identity is necessary for climate justice. The concept of neurodiversity draws upon scientific research and lessons from practice and lived experience to suggest new ways of thinking about neurodevelopmental conditions. And for those who do not know, neurodiversity describes the idea that people experience and interact with the world around them in many different ways. It is a concept that regards individuals with differences in brain function and behavioral traits as part of normal variation in the human population. It is also an umbrella term for a range of cognitive functioning, including autism, spectrum disorder, ADHD, or attention deficit disorder, dyslexia, dyscalculia, dyspraxia, developmental coordination, Tourette's, and other behavioral and neurological differences, including acquired neurodiversity such as traumatic brain injury and long COVID. However, there are important gaps in the literature that need to be addressed. For instance, recent work highlights there's relatively little is known about the impact of global climate change on the physical and mental health of people with intellectual and developmental disabilities. And the reason behind the exclusion for people with intellectual disability can be overlapping and include the built environment, strategy, and policy structures, information communication design, and social and political inequalities. And this deficit in the literature is becoming more important as diagnosis for autism, ADHD, and other neurodiverse conditions have become increasingly particular in countries with improved surveillance methods and diagnostic criteria. Um, Consequently, as a consequence, also less is known about low and middle income contexts due to intersectional stigma, a lack of access to services due to the fewer number of mental health providers focused on these differences. The World Economic Forum has advocated for integrating neurodiverse perspectives in addressing climate and environmental challenges. Indeed, there's room for the necessary research exploring the effects of climate change in neurodiverse populations, including their lived experiences, to better understand the association between lived experience and health outcomes, the pathways that affect health in these specific groups, and to point to potential areas of interventions to mitigate the direct, indirect, and intersectional consequences of climate change on neurodiverse people. I'm currently working on my next book, which I'm in the process of editing. As you know, there's a growing emerging literature that shows that climate change and associated extreme weather events are leading to poor mental health. And there's that gap in the literature. So the goal of the volume is to build on prior work in climate change and mental health equity by elevating the science of lived experience with perspectives of intersectional neurodivergence, nature, and climate change. Our voices, our stories, and our insights and our expertise as people with lived experience have the power to transform and improve the ways that climate change programs and policies and equitably address the needs of our community. And the stories within this book will tell the story of the journeys that people take, their experiences of nature, stories of why climate change matters in the context of understanding intersectional neurodivergence, aligned with the stories of neurodiverse discovery, strength, self-awareness, resilience, and belonging. And I would love if neurodivergent folks out there would reach out to me to potentially participate as part of the project. That would be really helpful.
That's fantastic. I'm really excited about this project, and maybe we can have a conversation about it in the future. And there's so many, I think, important implications for this conversation around neurodiversity and climate mental health, climate justice, including climate education and intergenerational climate communication and climate care. So I really appreciate all that you have shared around that. Um, and
And
I'm
I would love to have that conversation with you.
Yeah, that would be fantastic. Um, just for time's sake, I think we will have to wrap it up here. This was just kind of a taste and an introduction to this book and this conversation around climate change, mental health equity. I want to let our audience know that you can purchase the book on the climate mental health website on the bookshop. And that website is climatementalhealth.net. And if it is purchased through the Climate Mental Health Network, a small portion is donated, which is fantastic. And is there anything final that you would like to say, Rhonda? We're just so appreciative of your time. Thank you.
No, I just want to thank you so much for taking the time with me today to talk a little bit more about the book. I know we didn't get through all the questions, but just really appreciate you taking the time out of your schedule to talk with me about the book. And it's been a real labor of love, and looking forward to continuing working in this space.
It's fantastic. Thank you so much. And maybe we can have a continued conversation. All these conversations are continuous and so important. So really appreciative of your work, and thank you to everyone who will be listening to this. So I'm going to end our recording